Kara, so great to have you on the Slice of Healthcare podcast. How are you today?
Good. Thank you for having me.
I'm excited. We have not had enough authors on, and I think you're going to start a new wave of us changing that a little bit because I think it's whenever someone writes a book too, there's a lot of timely parts of the conversation that we can bring up. So what I would first love before we get started, it's your first time on the show, let's talk a little bit about just your background. And then let's talk about this book, like what drove you to want to write it in the first place. But let's start with your background.
So, my background most recently is that I'm the founder and I'm currently board chair, but I was CEO for 23 years at Quantum Health. And Quantum Health is a healthcare, we invented this space. It's healthcare navigation and care coordination. And we work mostly in the employer space right now, where employers will hire us to take care of their employees as they're going through their entire healthcare journey. But it's a different model where we basically curate the entire journey, and we work with people from the very beginning and help coordinate with their physicians. We're actually taking input from their physicians and guiding them through the journey. And as an end result, because it's such a bewildering experience for consumers, we end up making their journeys more efficient, saving money for them and their employer, as well as increasing their satisfaction significantly. People really feel loved and cared for along the journey. And we also improve their health outcomes. So it's a great thing. It really helps employers and it helps members.
Now, you had lots of experience in the space. What drives you to, after doing so much, to say, okay, I'm going to write a book now?
Okay. So I should say that even before I started Quantum Health, I started in 1999. I was an attorney, so people often focus on the fact that I was a lawyer and I worked in transactions. I did not work in healthcare very long. I got pulled into healthcare near the end of my time as an attorney. But prior to that, I worked in an international consulting firm that did consumer behavior research around how consumers experience a journey through, whether it's a shopping journey or a buying journey of a car, or banking services, things like that. And Quantum Health was kind of the culmination of those things coming together. And when I was working with provider organizations, I was pulled into the healthcare department at the firm because Bill Clinton had been elected. Hillary Clinton was taking on the healthcare system. And so there were all sorts of changes, structural changes happening in the healthcare system, which is not necessarily a system from the delivery of care where things change very often. It's not an innovative area. Medical technology, pharmaceuticals are, but actual care delivery, the models are pretty staid. And as I was working with provider organizations on their strategies, it was very clear to me that what we had was what I would call a pretty classic consumer pathway challenge. So I thought it was interesting, explored it, studied it, kind of got insights into the places where you could impact it and what kind of services you needed to help solve for consumer challenges in a healthcare journey, and really did a deep dive on understanding the human experience of healthcare, which people would tend to describe like Dorothy and Oz. And, it's bewildering, it's terrifying. And from that, became an entrepreneur and created a company that does that. That's now a very large company. And it was valued at over $1 billion in 2020. We've grown about 3x since that time. So the reason I wrote the book is because, the company hit 25 years last year. So the book came out early this year. So I was writing it last year. And one of the things I was aware of is that, there are not very many women who have hit a valuation that I have hit, that have started a company from zero and kept with it. Coupled with the fact that the company has created a space and is a real disruptor in the healthcare benefits space in an industry where you're up against these, basically it's a big oligopoly there. You have the 5 major carriers, including, kind of grouping the blues as one. that is not only unfriendly, it's outwardly hostile to any innovation that creates any disruption for them. So I kind of started a company as an outsider to the field. I was not a healthcare person. I applied concepts that exist in consumer goods and services and retail to the healthcare experience. I'm not a medical person or anything like that, so I didn't know what I didn't know, which was a good thing. Um, very few founders, let alone women, are able to grow their company and stay with it in a leadership position, including still today, at the size and scale that my company has gotten to, going from zero, and we were bootstrapped, so I did not go out and raise a lot of money to begin with. And it's a great company doing a great thing. It's rated one of the best places to work in the United States. So all of those things said to me that, when we were 25 years old, I was like, it's now or never. And I felt like, everybody was encouraging me. I thought, okay, well, this is probably a story that's worthy of being told. And I'm usually a very private person, but I thought that, it's a great story. It's a good story to kind of secure the foundation of the company as it scales for its next 25 years. And there's a lot of lessons that I've learned along the
Yeah.
way. So obviously, you don't get there alone, and it's not easy. It's very hard.
So first off, congrats on everything. 25 years is a huge accomplishment. And then also, I wanted to say to you, congrats on the latest acquisition.
Yes, yes, we just completed that this week. So officially, it was done. I mean, everything's done now. Yeah, we're on the
that
other
was big
side.
news. That was
It is big
like
news.
we haven't had that was like probably right up there in some of the biggest news of the year for healthcare, right? Everyone's been talking about like consolidation and these acquisitions to happen, but there's been very little movement. And then you make
Yeah,
an acquisition like that. So
yeah, it's
congrats.
exciting. It's a great company. Embold is a great company. Daniel Stein and his team are great. We're thrilled to have them as part of the Quantum Health family.
I love it. I'm going to ask you, Kara, just some questions kind of
Mhm.
about the book, and then also just kind of shifting in a little bit to your leadership philosophy, which I
Mhm.
think a lot of our audience would love to hear.
Yeah.
So, in No One Alone, you talk about seeing healthcare's complexity with fresh eyes. So, how did coming from outside the healthcare industry, you mentioned you were in the legal field, give you an advantage in understanding the challenges?
Well, I think in the healthcare space, a consumer. So I will refer to people who are having healthcare as either consumers, which is all of us. We all are consumers of healthcare, or members, which is when they're covered under our clients' plans, and because we're serving those people that are employed by our clients. Or I will refer to them as patients, as people who are getting care from medical providers. But the challenge with healthcare is that if you're in the industry, you tend to view it through your lens of your function. So doctors see them as patients, health plans or insurers see them as claimants, but no one sees them as the person, as the consumer. And I realized, early on when I was working with my task when I was a lawyer was to form a consulting company on behalf of the firm and go find a reason for it to be, because we wanted to do pre-transaction work for managed care, kind of set it up, strategize, all of those things. And I was the only person in the firm who'd had outside consulting experience, which was why I was picked for the job. But my work had previously been, as I said, understanding consumer journeys and how to make things work better for consumers if you were a store or product or whatever it was, which means that you had to really get on the ground with the consumer, put yourself in their shoes, forget what you're trying to accomplish. But if you really understand the journey, you will see where things disconnect and don't work for them and how to make that work better. And every time we had done that and we made it work better for the consumer, it had tremendous dividends with respect to increased sales or market share or whatever. So when I was working with provider organizations, I just sort of assumed that that competency existed in healthcare because it's ubiquitous outside of healthcare. However, what I discovered was that it doesn't. No one thinks about the consumer, the end user of healthcare services. And it's not even healthcare services. That's the wrong way to put it. It's a healthcare journey for the person. Getting medical care and treatment is one part of the journey. Having claims and having to interface with your insurance company is another part. But there's a whole thing called life. Like, you are not on a journey because you choose to be. So it's an unchosen journey that changes the whole character. You're under threat. I mean, you just described a situation that you had just playing a sport, right? And it's changed your life. It's frustrating. It's anger inducing. It's fear inducing, and it puts you in a more primal emotional state where you can't access your executive functions as well. And the challenge with that is healthcare. A healthcare journey is fabulously complex, and it's not gotten better. So 26 years ago, you didn't have, separate little point solutions that dealt with you if you had, a particular injury in a particular part of your body, and we will deal with just that. Or digital solutions. Digital didn't exist. You didn't have, cost quality of physicians. You didn't have all these new drugs. You didn't have treatment. Like treatment, there were, say 5 kinds of breast cancer. Well, now there's 200, depending on your molecular and your genetic makeup of your particular tumor and your own molecular makeup. So it's very, very complex. And we're asking people to figure it out at a time when they're at their worst and they don't speak the language. And the doctors can deal with them with treatment and diagnosis, but they're not dealing with these people and their life circumstances and all the challenges that they might have following through on what the doctor said, if they even understood it, because they panic in the treatment room or when they're listening to the doctor. So those were all the things that I saw. And because I wasn't wedded to, well, providers only do this, insurance plans are set up this way, these functions are done by the insurance company, I was not bound by any of that. I was purely curious about how does it work, because it sounded to me, I call them the bad patient stories, it sounded to me like it was fabulously expensive and a terrible experience. And I'd had experience solving these kinds of challenges before. So I just approached it the same way I approached everything else and said, let me just see how this works from a consumer standpoint. And I did a 2-year study tracking 3,200 people during their journeys and looking for, where did things go wrong for them? What was their state of mind? How did they experience it? Where did they turn for help? Was there anybody there helping them? And it helped me see, one, that there was a uniform solution to this. Even if even if a situation isn't complex, the person's experience of it is. It may not be complex medically. That doesn't mean their experience of it isn't. And it also helped me to see that you can't rely on claims to reach out to people and touch them. You have to touch them when they're first being diagnosed. And there's different entry points that we have. And so I re-envisioned the whole way of mapping out a journey and connecting with people. And the solutions are in taking pieces and parts that are done by insurance companies, done by the providers, as well as adding to that and having a service that we think is essential in benefits, but having a service that is there just for that consumer, that is able to get involved, because the providers are sending you notifications always about benefits and eligibility and et cetera. You can connect with that person right at the moment that they're being diagnosed, and then you can walk with them during that journey. So I was never thinking that you couldn't do any of this. And I thought that if you could design a service that would save money and improve the experience, improve outcomes, employers who are footing the bill, whether they're offloading it to an insurance company or holding on to themselves as a self-funded employer, would be interested in that. And we would be aligned with them, because these are their families. These are the people that work in their companies. And no one, I didn't pay attention to people who said, well, you can't do that. I'm like, it works everywhere else. Why wouldn't it work in healthcare? Turns out it does work in healthcare.
Well, I know there's a lot of people, both listening and then that you've helped along the way, that are very grateful that you decided to start this company. I want to go into a little bit more of your leadership philosophy now, because, whenever I do some prep before I have the guest on, I want to talk about the book, but I wanted to really dig into that because of, you have a lot of experience in the space. So let's start a little bit here. You emphasize empathy and curiosity as critical leadership skills. So, how can leaders today apply those qualities when managing complex healthcare environments?
So, first of all, again, anyone who's dealing with healthcare is going to have to touch the patient experience or the provider. You can touch just the provider experience if you're in a certain aspect of the industry, but empathy, healthcare is one of those things that, like I said, it puts people into their primal emotional state. And they are running, their levers are fear, your classic fear, fright, fear, anger, head in the sand, kind of ignore it. But in order to really, you can treat the body, but in order to heal the person or get them to improve, you really have to treat the whole person. And empathy is the unlocker to that. And empathy will reduce the stress level. I mean, people who are on a healthcare journey are extremely stressed for a long period of time, and the human spirit is not intended to be operating in a state of stress for that long. But if you extend empathy, they will trust you and they will reveal to you what real challenges they're having, and then you can solve for that. So that is true for doctors. It's true for anybody who has touched or touches the patient experience, to express that empathy, that I understand this is really hard, this is so challenging, I'm here to help you, I'm here to take this on for you, whatever it is. And in our organization, we understand that empathy is the unlocker, but we have this whole set of people. We have over 2,400 employees. So we need those people to be either working directly with the patients or, supporting the people who are supporting the patients directly. And my experience is if I'm asking people to extend empathy to the customer, ultimately the consumer, I have to show as a leader empathy to them, because it's hard. It takes your energy. You're dealing with very tough, difficult issues in healthcare. And again, even if the reason the person is on the journey is not life-threatening or terribly complex, their experience of it is. And I have learned that you must build empathy into your organization. So our employees must feel that we genuinely care about them, that they are the front line. They are the top of it's an inverted pyramid. Me, our CEO, our leadership team is down here supporting this organization that's delivering on this. And they are the most important people, because if they feel stressed, if they feel like we don't have their back, if we don't care about them, they're just a cog in the wheel, they're going to express that to the patients and the members, and then we're not going to get the opportunities that we get. And we rely too heavily on that relationship of trust to ignore that. And it's just really important in healthcare that your entire organization be one that's oriented toward empathy, because empathy is the unlocker. Empathy is what people need.
One of I think the best things that you did when setting up Quantum Health is you really rooted the company in data from the very beginning. So, how did your early research into the consumer healthcare journey shape your initial business model?
So the initial research, first of all, it helped us understand how the journey unfolds. Like, one of the questions I had is, and I was very aware that it's hard to any business. It's hard to kind of engage people when it doesn't come naturally for them. Human beings are driven by convenience. So you have to make engagement convenient, which means you have to actually intercept them. And that was a concept that came from retail and consumer goods and services, this concept of intercepting the consumer at the moment that they're looking for it, even if they don't know you exist, and being there. And so in healthcare, I started thinking initially about, okay, how do I even know that someone's on a journey? And so I looked for what are repeatable patterns that occur on a regular basis that you can rely on to tell you, oh, something's happening. And what we found is that in the research, every time a doctor's office sees a patient, they do a benefit and eligibility check. That goes to an insurance company. They answer it, they get off the phone, they don't even record that information. But the most important thing about that is, why is that patient going to that specific doctor for what, and have they ever had anything like this before? And so I found these points. There were three critical points where people presented, and you knew, okay, so they're on the front door, they're entering a healthcare journey. So now I have an opportunity to work with them. The next question was, okay, well, if I'm going to help somebody, what's the complement of expertise I have to actually be able to help them and not disappoint them? And that kind of defined that helping people get through a healthcare journey safely requires a intricate, complex mix in real time of clinical knowledge, benefit knowledge, ecosystem knowledge, and human touch. And it requires those things. And if you can bundle those together, which without quantum health, to the extent they exist in 13 to 15 different service points. So you don't have that. But you combine those two, and then you combine the data from that, and that tells you everything. So the research that I did was very data rich, and it really helped map out what you needed in terms of capabilities. The next question I had was, as I started the company and mapped it out, then how do we know that we're actually having an impact? And the company has, since the very beginning, been committed to using independent methods and independent companies to do analysis of our data to say that, yes, the things that you are doing are having an impact. So let's say during the first year of a group, the client brings us in. Our value proposition is we generate savings, satisfaction, and outcomes. And we bring that client in. Typically, our clients will see their claim trend be about 5 to 6% lower than where they otherwise would have been. That's a lot. A portion of our clients actually see a negative trend in the first year. And the only difference is us. So then we were manic about understanding, what is it that we're doing? Is there something that we're doing, or is this just a good luck year? And the answer from the actuaries was, no, it's not just a good luck year. Here are the things that we're doing. So we measure that constantly. We're a very data rich company. So we have data coming into our company from 700 plus outside vendors. And I would put our data set up against even the major carriers, because they're not bringing it in from all these outside parties. They have their own originated data, but other than that, it's sort of a closed system. And we now, with the acquisition, will be serving 8 million people. That's huge. So it's a large block of people that we have the ability to have visibility on what's happening with them. How can we help them? Are they moving from point A to point B? And we have actually, as new techniques have become available with AI and things like that, we're leaning heavily into that, because healthcare is so complex. We call them warriors, our healthcare warriors who are working directly with the members. We need our warriors to have immediate access to things to help them solution for. They need immediate access to all the information about what this person's doing, so they can ask very intelligent questions of them and really get a sense for where their challenges may lie. So Quantum Health, while we are a big-hearted company with a very touchy-feely kind of emotional relationship with people, it is a very disciplined, principled business that is built on data, because data is what tells us what's going on and what we can do about it. And it helps us prove that we are in fact having a meaningful impact on cost of care for our clients, for the members, because people are bearing a larger portion of their healthcare spend. They don't, people are often bearing like $3,000, $4,000, $5,000, and that's a lot of money when they have these high deductible healthcare plans and things, and on their outcomes, on their clinical outcomes. So all those three things, satisfaction, we use Net Promoter Score, world class, for running at 70. So all those things are things that we measure with a fierceness to make sure that we are delivering on our promise.
I love it. Two more just quick things for me before we wrap up here. If our listeners could remember just one piece of your journey and from No One Alone about leading through complexity, what would you want it to be?
You lead through complexity by getting to the art of simplicity. So at the end of the day, what we do is very complex, but it's actually quite simple. It's about helping people. No one navigates healthcare alone. And I think all businesses can come down to a mission like that. What are you doing it for? And the answer, I believe, always lies in your end consumer. They will tell you. They may not know they're telling you, but if you're looking for it, you will figure out how to make it work and how to orchestrate and organize and deliver on a promise to them. But it's really simple. Ground yourself in your end consumer. Believe in that. Believe that you can do the best that you can for them, and all the complexity is just a means to an end.
Last question for you, for the people that are listening that want to, they want to purchase your book now, which everyone, if you're listening, you should. Where can they go?
So they can buy it on Amazon. They can buy it on Barnes and Noble, and I don't know what bookstores are selling it, but Allison can send you the link. I don't actually have the link available. Isn't that's I'm not. That's not. I don't live in that world so much, but yes, Amazon is the best place to get it. So
Okay, we'll include that in the show notes for
yes,
anyone
thank
listening that
you.
wants to go ahead. But Kara, it's been a real pleasure having you on the show and learning more about your background. And congratulations again on all your success and for what you're doing in the healthcare space. Look forward to future conversations, and thank you so much.
Thank you, Jared.